We're going to assess the cranial nerves. Cranial nerve number 1 is the olfactory nerve. We're going to test the ability to identify different smells. So Mallory's going to close her eyes and then close one nair and sniff and tell me what she's smelling.
Vanilla, vinegar, cinnamon.
Okay, I'll do the other side. We'll change up the order a little bit.
Vinegar, vanilla. That's a long one. I like.
I know, I was like, she's not going to get it. Okay.
Cinnamon,
Cranial nerve 1 is intact. Cranial nerve 2 is the optic nerve. When we assessed the head and neck, we did a vision acuity test, near vision, also with the Snellen chart and Rosenbaum chart, and ophthalmoscope examination of the fundi. And Mallory had vision of 20/25. Cranial nerves 3, 4, and 6, the oculomotor, trochlear, and abducens. Test the visual fields, look at pupil size and reaction to light. Cranial nerve 5 is the trigeminal nerve. I'm going to have Mallory clench her jaw and feel the muscle tone in her jaw. You'll look for muscle atrophy in the face in each grouping. So we'll have Mallory close her eyes and we check the function of the nerve with 3 different touches: light touch, dull touch, and sharp. So we'll have her close her eyes and she can tell us.
sharp, dull, light,
Check the other side.
dull, sharp, light.
Shows cranial nerve number 5 intact, the trigeminal nerve. Facial nerve is cranial nerve number 7. You'll ask the patient to make different facial expressions and movements of the face to see if the nerve is intact. You raise your eyebrows, smile. I'm going to look that both sides are functioning the same. Puff your cheeks out. Press your lips together like kissing. There you go. Big wide smile showing your teeth. And squint your eyes closed. So cranial nerve number 7 is intact. Cranial nerve number 8, the acoustic nerve. You evaluate hearing. When we did the head and neck evaluation or assessment, I stood within a couple feet of Mallory and she did the whisper test, and then she would repeat what I say.
A, C,
And then we check the other ear.
F, T,
Cranial nerve number 8, the acoustic nerve is intact. Cranial nerve number 9, the glossopharyngeal. Cranial nerve number 10 is the vagus nerve. To test cranial nerve number 10, the vagus nerve, have the patient stick out her tongue, let her know you're testing gag reflex. And you're going to look inside to make sure the uvula is midline and you have the patient sip and swallow to watch. Okay. To assess cranial nerve number 11, the spinal accessory nerves. Push down on the shoulder and have patient shrug. Be sure that both sides are equal. Cranial nerve number 12, the hypoglossal nerve. You'll inspect the patient's tongue in the mouth and at rest. Make sure it's nice and even. Both sides. Have the patient stick her tongue out. Move left and right. Equal movements. And that's how you assess the cranial nerves. Gross motor movement is assessed. You can watch the patient walk to be sure the gait is good. Coordination and balance. You're just going to walk. Okay. We're going to have the patient walk heel to toe. No problems. And then stand and hop on one foot. And then change feet. You can use the Romberg test to check for balance and equilibrium. The patient will stay with their feet together, close their eyes, and hold their arms out to the sides. Okay, good. Fine movement can be checked with the patient. She tap the palmar side of her hand to her thighs and then flip them over, back side, and slowly, and then getting more and more rapid. Checks for fine motor. Okay, that's good. You can also use the thumb and finger test, where now we'll take her thumb, touch it to her forefinger, and then every other finger after, and then back. And you would check both hands with that. That was the point-to-point assessment. We would have the patient take her to check the lower extremities, her toe, and run up the shin of her leg on both sides. And test sensory function to different parts of the body with light touch, dull touch, sharp touch, and vibration. You can do that during a typical assessment as you assess the rest of the body. With 2-point discrimination, you use 2 sterile needles, and you start out touching the patient. We're going to see at what point the patient no longer feels 2 needles, but just 1 point. 1. Okay. So that was at about 10 millimeters. She could no longer distinguish the 2 points. We can also check discrimination by using an object to draw a shape on the palm of the hand and see if the patient can determine what we're drawing.
Triangle. Circle.
Okay. You would check that on both palms. Bicep reflex is tested. You have the patient have her arm 45-degree angle, thumb on the tendon of the bicep, fingers below, and then tap your thumb. Test the brachial tendon. We'll have you rest like that on my arm. Triceps reflex. Do a 90-degree angle supporting the arm, then palpate the triceps tendon and strike. Patellar reflex is when the patient dangle their leg and you strike. On the legs, you assess the patellar reflex, Achilles reflex, and clonus. The reflex on the patellar, and the Achilles. and the clonus. The plantar, the Babinski reflex. That's the assessment of the nervous system.